Welcome everybody, my name is Dr. Bunola Mashishi and thank you for joining Ask Your Doctors. A warm welcome to our usual family guests and to everybody who's new, welcome. So we are wrapping up Women's Month and we got the privilege of doing it in Durban. And certainly I get to understand finally why they call it South Africa's playground. It's been phenomenal. Joining me today, obviously I never go alone, is Dr. K and our special guest. Today we get to talk about everything endocrinology. But before we get that, Dr. K, how's it been?
Hi, Dr. Kumari, how are you?
I'm good, thank you.
All right, thank you.
Yes, how have you been enjoying Durban?
I'm sad.
I'm sad too.
Yeah, you have to go back home.
Yeah. No, I mean, the people have been phenomenal. The conversations that we've had with our guests, it's been phenomenal. So, yeah.
The weather.
The weather, it's been...
The sinus, gone.
Everything you healed. Yes, and Dr. Kumari, thank you for joining us today. You're an endocrinologist, and maybe you can start off by telling us what is endocrinology.
Okay, well, good morning, Bunola and Dr. K. Thank you so much for having me on the show today. It's actually such a privilege and an honor for me to be here, and I'm glad that you've been loving Durban. An endocrinologist is a specialist doctor who specializes in treating problems related to the hormonal system. So what we are is we are first specialist physicians. We've gone through 4 years of internal medicine specialist training, and after that we spend another 2 to 3 years studying the hormonal system and studying the body's endocrine system. So basically what this is it's a system of glands throughout the body, and these glands produce chemical substances called hormones. And you may be surprised, but we actually need our hormones to control every single process that goes on in the body, from our sleep to our appetite, to our weight, to our sexual function. All of these things are finely controlled by our hormonal system. So any imbalance there can then result in disease. Okay.
So, Dr. Kumari, it's a tradition of ours on the show, especially when we're welcoming somebody new into our family, you know, to kind of aspire to inspire somebody who's out there, the young people. Maybe if you could tell us your journey, what inspired you to go into medicine, what inspired you to follow the pathway that you did, and what needs to be done to get there?
Well, Bonola, the truth of it is, it's not really what inspired me, but it's rather who inspired me. For myself, I've got a personal story. My father's a doctor. He's actually a cardiologist. And so growing up as a little child, medicine was always something that was very close to me, something that I became familiar with. I would hear my dad often chatting to colleagues, discussing patients. I would hear him having conversations with patients, and you could pick up how appreciative they were for his knowledge and his expertise. But I think the thing that really made such a difference to me was seeing how he interacted with his students. I remember when I was very young, I was lucky enough to attend 1 or 2 of his tutorials, and his passion really rubbed off on the students, and he left such a legacy with these students. And you know, that's really what inspired a love of learning in me and a love of medicine in me. So what I would say to the you know, the people out there, or the youth out there who are thinking of pursuing a path in medicine, firstly, it's not easy. It's, you would know yourself, it's, you know, it's long hours, it's being on call, it's a commitment, and it's a lifestyle commitment. It's not just a career path. But you know, if you're doing it for the right reasons, and if you have the inspiration behind you, then you can really go the distance.
Let me say, Doc, it is our pleasure to welcome your dad on set. Thank you for bringing him. And Professor Naidoo, I believe.
Yes.
Yes, he's retired now.
He is. He was at Albert Luthuli for many years as the head of cardiology, and he was a professor for many years at Albert Luthuli Cardiology. He's retired now, but he still keeps a very active role with his students and his research.
Now you have inspired me.
Yes, and might I add, sorry, continue.
No, and I know that you also know Dad well.
Yes, I was going to say, you know, I was also one of those students who was possibly inspired. So we thank him for his service.
But I have to say it's also quite stressful because whenever people look at me, I think, wow, I've got huge shoes to fill.
Yes, can imagine.
It happens.
It happens, yeah. So, you know, it's important maybe to kind of also clarify for someone who understands that, yes, endocrinology is about hormones, but they don't really know where these hormones are coming from. So which parts of the body are actually, you know, make up this hormonal system or endocrine system. Yeah.
So the endocrine system is a complex system. It spans the entire body, and there are glands throughout the body that produce hormones. The commonest gland which people may know of is the pancreas. That's a gland which is situated in the upper part of the abdomen, and it produces the hormone insulin, which is defective in people who have diabetes. The other very common gland that people will know of is the thyroid gland, and this is a gland that's situated right here in the neck, and it's a butterfly-shaped gland, and it produces our thyroid hormones. But there are countless other endocrine glands in the body. In men, we have the testes, which produce testosterone. In women, we have the ovaries, which produce estrogen and progesterone, that's responsible for the menstrual cycle. And we also have a master gland situated right in the center of the brain that's called the pituitary gland. And that really controls the hormonal makeup of the entire body. It's almost like an orchestra conducting, a conductor conducting an orchestra.
Yes.
Yeah.
So, Dr. Kumari, maybe, I mean, you've just explained to us, you know, which parts of the bodies the endocrine glands are found. And I can only imagine the numerous conditions that can then present to you. But what do you commonly see in your practice? What do people come with?
Okay. The largest portion of my practice is related to diabetes, Bonolo. Endocrinologists treat various types of diabetes, but by far the commonest is type 2 diabetes. That's the type of diabetes that you will know that maybe your parents have or your grandparents had. It's a type of diabetes which is related to lifestyle, and there's also a strong genetic history. The type of lifestyle that would predispose to it is if you were not physically active, if you were leading a sedentary lifestyle, if you were having a diet that was very high in carbohydrates and sugary foods. All of these things are risk factors to develop type 2 diabetes. And people who are actually particularly at risk are those who are a little bit overweight, particularly if they're carrying their weight in the abdominal area. So our ultimate goal is to try to address these risk factors early on, and that prevents complications from developing down the line. These complications are things like heart attacks, strokes, amputations, kidney disease, and blindness. And we know that if we control all of the risk factors to a T in people who have diabetes, they actually won't suffer these complications in the long term. The other big part of my practice is managing young people with type 1 diabetes. Now, type 1 is quite a different disease to type 2 diabetes. It doesn't have such a strong lifestyle component. It's more of an immune disease where the body's own immune system destroys the endocrine gland, the pancreas, and so people with type 1 diabetes have to be on insulin therapy, and they have to be on insulin therapy from diagnosis. And this is actually something that I'm quite passionate about because
I can tell.
Well, to be honest, my passion is managing endocrine problems in the youth. I know that if we target lifestyle and healthy living early on, then we can prevent these things from happening, and we can prevent complications later on. But the other reason why I really enjoy managing type 1 diabetes is because there is huge progress in this field. Over the last few years, we are seeing new technologies which are really changing the lives of people with type 1 diabetes.
Yes.
Now you can imagine, Dr. K, if you had type 1 diabetes and your body is not producing insulin, it means that every time you eat a meal, you need to inject yourself with insulin before that meal to prevent your blood sugar from spiking high after the meal. And I've just brought along to show you some of what an insulin pen looks like. So this itself is a little bit of progress. In the past, when people needed insulin, they used to have to draw it up from little vials in syringes and give it to themselves. Now it's a little bit easier. It comes in a little pen like this, and you can see that there's this clear substance here, which is the insulin, and then we would ask our patient to put on a little needle. So, Dr. K, do you want to have a look and see? Would you be afraid of that? That's a tiny
Only a baby
needle.
doc.
Oh, no, please don't.
No, actually,
Just
I'm
in your
scared of
arm.
needles. I am scared of needles.
But it's very tiny.
It is very tiny.
It's,
yes.
it's not a bad.
Yeah.
So now we are actually improving where we know that this is still, even though it's a little needle, it's still cumbersome. Imagine having to inject yourself every time you take a meal. We now have devices like insulin pumps, which actually deliver the insulin automatically to our patients with type 1. And for those patients who can afford it, it is really life-changing. Another thing which I've brought along to show you is our new glucose monitors.
Okay.
So the standard way of monitoring one's sugar is to do a little finger prick. I'm sure you've seen those devices, but that can also get cumbersome, especially in our young patients. Asking them to test 4 to 6 times a day can be really disruptive. And we've also realized that we need to understand really what's happening to the blood sugar. We need a lot more data. And therefore things like this are now coming into vogue. This is a continuous glucose monitor.
Okay.
And I've put one onto myself to show you. This tiny little patch here is a monitor which is continuously measuring my blood sugar. It's very easy to apply. It doesn't, once it's on, you don't think about it at all. I had a shower with it this morning. It stayed. And the nice thing about it is that it connects to your smartphone or your smartwatch via an app. And whenever you need to know what your blood sugar is doing, all you do is scan over.
I believe it's scanning.
And then it's scanning, and then it's given me my reading, 5.4.
Which is normal.
Which is, I think I'm safe.
Yes.
Yeah, but that is just one of the technologies which is making the lives of people, especially the younger people with type 1 diabetes, making their lives a bit easier.
Awesome.
And it makes it, I suppose, very easier to integrate, into their lifestyles.
Absolutely.
Because you need to continue living just because you have
Yes.
diabetes.
Yes.
So you can't really just be like, oh my goodness, it's 1 o'clock, I have to go, inject myself and so forth and so on. So it really is,
Yeah. Even, Bonolo, for things like exercise, you would need to know what your sugar was before you exercised.
Certainly.
You're at risk of it dropping if you exercise too hard. So something like this, which is giving you the data all the time, is really useful. The pity is that not all medical aids cover this, and this is not something that's readily available in the state.
Yeah.
But diabetes patient advocacy groups are really striving to get this technology available, particularly for our youth.
Is most of this prescription issued, or can we get it over the counter, or can we get it online, and which is the safest way to do it?
What are you talking about, Dr.
The-
K? This
the
specifically.
monitoring patch,
So the monitoring patch, the monitoring patch is available online. So there's a site that you can order it from, and they will deliver you one, and it would last for 14 days, and it will give you data about what your sugars readings are doing for 14 days. Not everyone needs this. As I mentioned, mainly younger patients, and also if you're an older patient with type 2 and you're really battling, you're having a lot of lows, you just want to know what your pattern is, then this is something which is useful to do just for a short period.
And I'm thinking for my mom, because she's been hospitalized a few times.
Yeah.
She's 89 now.
Yeah.
And it's shot up very much and shot
Yes.
low very much.
Yes.
And then my sisters will be bickering with her about, you're overusing this, you're doing that,
Yes.
you're overeating this. And
Yeah.
so just to be more certain, to study the patterns,
Just to get an
and-
idea of the
and see what's
pattern.
going on.
Yeah.
But clearly the insulin has to be prescribed. You cannot just buy it anywhere.
Oh no, certainly not. If
Yeah.
insulin is something that your patient needs to be thoroughly educated if you're starting them on insulin. This, as good as it is to control the blood sugar, there are risks. The major risk that we worry about is low blood sugar. So before we were to start anyone on insulin, we would have to teach them how to inject, where to inject, what are the symptoms of a low blood sugar, how do they respond appropriately to a low blood sugar. And it's actually not just important to educate the patient, but whoever the caregiver or the family with that patient, it's important for them to know, because heaven forbid there is a complication, you want the family to be able to come in and step in and manage it.
And assist, yeah.
You know, you speak of your passion to try and prevent the youth losing themselves health-wise.
Yes.
I happen to have kids, and that's a big thing for me.
Yeah.
Self-preservation. So you will find me sometimes sitting with my son and his friends, maybe in their late teens, early 20s.
Yeah.
And I will be going on about, these are the careers you could choose. This is what you could look at, this and that and that. And then I will also be going on about your health.
Yes.
And the way I put it is, I say, if you are 19, 20 and you have a flat stomach, it is to your advantage to maintain that.
Yes, absolutely. You couldn't be more right.
Yeah, because your testosterone levels are at their peak in your late teens, early 20s, and then they drop, and you lose muscle tone.
Yes.
So we're talking about carrying your weight in your belly.
So Dr. K, you mentioned where we carry our weight, and that is extremely important. The weight that we worry most about is the weight that sits in the belly. For ladies, you know, with our figures, we tend to have more weight on our thighs and our bums, and that tends to be really fairly safe weight. It contributes to our figures, but it's the weight here that is a problem for men and for women. The reason is that when you're carrying a lot of weight in your tummy, it generally means that deep in the abdomen, deep inside, surrounding the organs, that there's a lot of fat depositing there as well. So when fat goes and deposits around the pancreas and around the liver, it makes these organs resistant to insulin. Okay, and this is one of the major problems in type 2 diabetes. Even though the pancreas is producing insulin, the insulin actually can't do its job because the body is resistant to it, and so it tries to act, but it has this resistance from the body. Then what happens is that, so insulin is there to take sugar from the bloodstream and transport it into the cell so it can be used as energy. But if you're resistant to insulin, that sugar is trapped in the bloodstream, and so the sugar levels tend to rise. And we find that people who have increased abdominal weight are prone to insulin resistance. The good thing is, though, if you lose weight, even if you're just to lose between 5 to 10% of your weight, and particularly if you're losing the weight from the abdominal area, we can actually improve insulin sensitivity and we can improve glucose control so much.
So it's not so much that you can reverse the diabetes condition, it's you can improve your ability to sense insulin.
Absolutely, but Dr. K, you're right. Some forms of diabetes are actually reversible. We find that patients with type 2 diabetes who present to us early, just when their diabetes is diagnosed, can reverse their diabetes. Particularly if they are a little bit overweight and they focus on losing the weight, they focus on diet and exercise, they improve their insulin sensitivity, and we find that in some cases, yes, we can actually take them off medication. Of course, if you want to maintain that, you have to maintain the healthy lifestyle, but definitely it is possible in some cases to reverse your diabetes.
Something else that the audience can relate to regarding diabetes is the fact that, you know, we always say it's genetic.
Yes.
And I know of certain people close to me, some family members, younger people, that if you say to them, don't do this, try and exercise, lose your belly fat, and they say, no, if I do catch diabetes, it's in the family, so it's understandable. But what I usually say to them is that if you are born in a village, in a township, in a squatter camp, you always work your way out of your beginnings. You never say, I relate to where there is no water on the tap, but you work yourself to a place where there is water coming out of your tap every morning. So you cannot accept just because you grew up with people that have diabetes, then you must die because you grew up with people that have diabetes. You know, it's not something you should accept and live with because it is in your family. You know, so I'm sure it's something that we should take heed of. Same with cancer, right?
Yes.
You cannot just accept that cancer runs in the
No.
family, so I'm waiting for it to happen.
Yeah.
You have to say, how
gonna
can I
try.
work my life differently? Your
Yes.
destiny is in your hands.
So I would agree with you. We can't always blame our bad genetics,
Yeah.
or if we have them, we have to do everything that's possible so that they are not so influential. And that's lifestyle. Even with cancer, we now know that so many of the common cancers, breast cancer in women, so many of those things are actually related to overweight and smoking and lifestyle. So we can definitely have an influence, and we can definitely change our health trajectory based on what we're doing with our lifestyle.
I wish we could speak about diabetes forever. Tell us a bit about
I do that
thyroid.
every day.
No, I've always wanted a situation, so don't be surprised if we bother you and say we can host you in Joburg and you come and tell us about diabetes again.
It would be such a pleasure, Dr. K.
Yeah.
You know, I hope that the young people and all the people realize the gravity and the seriousness of this situation,
diabetes, yeah.
because Bonolo, you will know the people that we are treating with complications like heart attacks and strokes, they're not always older people,
Yes, yeah.
they're often young people.
Young people.
And when they leave hospital, you're not leaving the same as when you came in. You're leaving with some sort of disability that's going to affect
Yeah.
your capacity to work and earn a living. And so it's of utmost importance that we control these things.
Yeah.
The other thing that we didn't touch on is smoking. You know, that's a major risk factor that is completely modifiable and avoidable.
Yeah, I know. We talk about smoking all the time. And the thyroid, how much of a spread would you say thyroid is in the communities?
It's extremely common. Thyroid disease is common across the globe, and we see it very often in South Africa as well. The most common condition we see is an underactive thyroid, or we call it hypothyroidism. And people who have that will present with feeling tired and fatigued. They may have some weight gain as a result. They may feel very cold and very lethargic, and it also affects all of our bodily processes like our menstruation and our bowel habits, etc. So that is fairly common, and certain people should actually test for that if they are at higher risk.
And does diet affect thyroid?
Fortunately, diet can have some effect on the thyroid. This is because in order for the thyroid gland to make its hormones, it needs certain nutrients. It needs enough iodine, it needs enough protein, it needs little micronutrients like selenium and zinc and vitamin A. We're fortunate in South Africa because most of our food is iodine supplemented. So we don't really have iron deficiency, and that's not a common cause of thyroid disease in our environment. I would say in our environment, rather than diet, it's more an autoimmune thyroid disease that we see more often.
Okay, supplements, do they help? Or for thyroid? And maybe prescribed by a doctor?
I think, you know, from maybe if you were to see a nutritionist or a dietitian, they would advise you on supplements. But from an endocrinology point of view, from my point of view, I would rather say, you know, generally following a healthy diet, your smoking, avoidance of smoking, doing your exercise, that's really all you need to keep your thyroid healthy. And then if you do have the tendency to develop thyroid disease, and it does happen, what we would do as endocrinologists is prescribe you the hormone replacement, the thyroid hormone.
So is it more common that we're seeing maybe underreactive or underactive thyroid versus over?
Underactive thyroid is generally far more common than overactive thyroid, but I see a lot of cases of overactive thyroid. This presents completely oppositely to the underactive thyroid. So we often see it in younger women, and they will come in having lost a lot of weight. Despite the fact that they're eating more, they tend to lose weight. They feel very hot and sweaty all the time. They may have a fine tremor in the hands. They feel a very fast heartbeat. And often they have a swelling in the neck from a swollen thyroid gland, which we call a goiter. And they may have bulging eyes. And that condition is something that we can treat with medication, and we can treat with radiation. It's not very common, but once it happens, it's very easy to detect and manage.
I picked up quite a number of things that potentially someone might, spin around, and there's always going to be misread information about, any condition, thyroid, diabetes, whatever it may be. What are the myths that you may have picked up that need to be debunked?
The first myth that I'd like to discuss is something that Dr. K touched on already, which is only older people get type 2 diabetes. Okay, this is definitely not true from what we're seeing. I'm seeing patients as young as 20s and in their late 20s, early 30s coming in with type 2 diabetes. You really don't want this to happen, because then you are committing yourself to medication for a long time unless you make the necessary changes. And the other thing that I think is bringing this out so much is the lockdown lifestyle that we have adopted. It was necessary during the time of COVID, but think about it, we're spending so much more time at home, ordering in a lot, constantly on our screen, not going out, and that has really affected our metabolic health. So number one myth is type 2 diabetes, or myth that I'd like to debunk, is to say that type 2 diabetes is happening earlier and earlier. The second one that I wanted to speak about, you've also already touched on, which is genetics. And if your genetics are bad, it's inevitable that you're going to get diabetes and other conditions. I think we've touched on it thoroughly. That's not the case. We can definitely modify the effect of our genes by our lifestyle. And then
facts?
what else? Facts. Two facts. Okay, first fact, losing just 5 to 10% of your body weight. So if you weigh 70 kgs, losing about 5 to 7 kgs, that will dramatically improve your sugar control if you're diabetic, and it may even reduce the amount of medication that you need. That's fact one. That was weight loss. Fact two, exercise. Okay. Exercise is an amazing tool for anyone who's diabetic to use so that they can control their blood sugar. When we exercise, what happens is we reduce that insulin resistance. So when we exercise, we have in our muscles little receptors for insulin, and they actually get expressed on the outside of the muscle, so that your muscles can start taking up all of that excess sugar from the bloodstream. So exercise can be used almost just as well as medication to give you some sugar control. So what I say to all my patients, if they're not exercising at all, start slowly. Start with a 20 to 30 minute walk a day. Have that walk around the time of your biggest meal. So if you know that your biggest meal is at supper time, maybe do that walk a little bit before, and then you know that by the time you get to supper, your body is nice and sensitive to the insulin, and whatever tablets you're taking are just going to work better.
And tips?
Stop smoking. So maybe I can show you this as my tip. So this is, we're going on and on about diet, but I think we need to show some people some practical things that we can do. So this is an idea of how a person with diabetes, but not just a person with diabetes, even any person should structure their plate. Now, maybe ignore the writing, but Dr. K, if you were, I know you're a healthy person, but if you were going to dish up for yourself, how much of your plate would be carbohydrate? How much of it would be protein or meat? And how much would be veg?
At my best, there wouldn't be carbs. There was a time I used to eat, I would cook on Monday, butternut. I would cook butternut, and I would cook broccoli, and I would cook chicken.
Yes.
As boring as it sounds, I would warm it up over 2-3 days and eat the same thing, and I didn't mind. But I have regressed. I must go back.
Yeah.
You understand? So it would be butternut, broccoli, and 2 pieces of chicken.
Okay, but we can't use you because you're a very good example.
But I was good then.
You were good then. Now it's a different. So you should have told us now what you're doing. If we were to think about how a normal average person would structure their plate, and how an average person would dish up, most people would put rice or putu or pasta over most of the plate. For me, I'm Indian, I would have 2 or 3 rotis on my plate. That means that I am eating, the majority of my energy is coming from carbohydrates or starch. What is carbohydrates? Carbohydrates are substances when you put them into your mouth, and when they get digested, they actually get digested into sugar. So that's why we worry about people with type 2 diabetes eating too much carbs. Now, I never really recommend to my patients to go carb free. The reason is, although it's very good, it's difficult to sustain. And any lifestyle changes that we are going to advise, we want them to be things that people can maintain. So I would suggest, what I suggest to them is just try to reduce the portion of the carbs that you're having. So instead of having the whole plate, just that quarter, reduce your carbohydrate portion. And how do we make it up? Because a lot of people will be wondering now, we're going to be hungry. We make it up with this portion of the plate. At least half of our plate should be vegetables. And what type of vegetables specifically? Green leafy vegetables. These are things that don't spike our blood sugar. And these are things like cabbage, as you were saying, broccoli, spinach, lettuce, all of those things.
Popular,
So how can we do this practically? Start with one meal a day. Okay, start with maybe dinner, introducing a portion of green leafy vegetables at dinner and trying to reduce your carbohydrate portion. And once you get used to that, maybe do that at lunchtime as well. And if you do it for 2 meals a day, then you're on your way to a healthy diet.
What is the story behind having rice at night predisposing you to diabetes?
That, I think, comes from the fact that rice is a carbohydrate, and it will therefore push up your blood sugar, particularly if you're eating very processed rice or white rice. There are certain rice choices which are better. At night, why do we worry about having it at night? What we need to understand is that we want to give our bodies some time where we ask our body to digest food, and when we're asking it to digest food, we're asking it, please produce all of these hormones to help us absorb that food, like insulin. But we also want to give our body a complete break, a time where it can not be digesting, a time where it can actually be resting and renewing, and where our insulin levels are very low, or our demands for insulin are very low. So if you're eating a large portion of rice just before you go to bed and you're going to bed immediately, it means that you are demanding that your body produces insulin to actually digest that. If you're someone who's diabetic, you may not be able to cope well with that rice in the evening, but it doesn't mean that you can't have it. Most people, eat rice for supper. What you can do, as I've advised, is reduce the portion, fill that portion up with your vegetables, and the other thing is try to have that dinner a little bit earlier. So we know that those of us who eat later on, who are having our dinners at 8 and 9 and 10, that means that by the time we're going to sleep, we're already asking our body to produce a lot of insulin to help us to process those carbohydrates. If we move our dinner time a little bit earlier to about 6 o'clock, it means that we can just allow our body to rest and restore and repair overnight.
I was going to ask you how you factor in load shedding, but I don't think you have all the answers. But anyway, it's fine.
I don't have all the answers, Dr. K.
Let me pick your brain.
Yeah.
COVID is brain fog part of long COVID.
Yeah, I mean, we've spoken previously about long COVID, what really happens when one is experiencing long COVID. Another phenomenon that people often complain about is that they don't quite feel themselves after COVID, especially in terms of their memory, Things literally become foggy. So it's not really a scientific term, but it's how people describe it, They are forgetful, they struggle to concentrate, they just struggle to get their memory or their brain functioning as it should before they actually have COVID. And unfortunately, it's something that people experience for several months. Some people as long as a year they can experience this, and it's not quite clear what's really going on. There's structural damage to the brain because of COVID, and other factors. But what they do advise is really to help speed up the process. You can really get into, we've been speaking a lot about lifestyle. Lifestyle is the answer for pretty much a lot of things. There's no treatment for it, but you can rehabilitate yourself into getting better and recover. things that stimulate the mind. You know, exercising is one of the ways, you know.
Crossword puzzles and that
Yes,
sort of
yes. So,
Sudoku.
yeah, so you
Just
really need
challenging
to
yourself.
do developmental exercises as you would a
Yeah.
child, you know, just
Wow.
to stimulate the brain so that you can start getting into better brain function, yeah.
I have my own brain fog, which is why I didn't tell the audience that we were going viral. In case they are wondering why I am asking you.
Slow,
Yes. But
okay.
look, it's been a great August month, and I am glad it looked most of it like I was watching Wimbledon. I was doing like this. It's
Yes.
women were doing their thing, and
Yeah.
we were on leave in Durban, and shame. Someone was asking from the crew,
Yeah.
how conscious are we of load shedding now?
Yeah, no.
You try and keep it off your mind. They say, one psychologist on our show usually said, do not absorb the bad news. Sometimes shut off.
Yeah.
So
yeah.
we are living.
It's sad.
It's a
But
bit-
we will look for the positive wherever we go in Joburg, you know? Yeah.
Doc, please tell us where they can find you.
I have two practices. I'm specializing primarily in endocrinology and diabetes, but I do some physician work as well.
Okay.
They're based in Amshlanga Hospital, Netke Amshlanga Hospital, and in El Belito Hospital as well.
El Balito, you say?
Yes, yes.
It's important. Okay. And online and on the socials?
So online, I must say, I still have to get myself a professional online presence. I don't think you want my personal online.
You can plug in there.
So that still needs to happen. But one of the websites which I find so valuable is a website called Diabetic South Africans.
Okay.
You can find them online. You can also find them on Facebook and I think on Instagram as well.
Okay.
And they've got an excellent podcast called The Sweet Life. So for anyone who's inspired just to know a little bit more, for people who have just been diagnosed with diabetes and who want to try and reverse this and make the change, or even for people who've been battling with their diabetes for a long time, it's such a brilliant resource. It's very easy to understand. They discuss simple ways to start an exercise program, to modify your diet, and I would suggest that people use that resource. It's really valuable. It's taught me a lot.
Okay, one of the professional platforms where people can find you is our website.
Oh, I really appreciate that.
We will take your details, post them on the website,
That's
and
wonderful.
guys, you can go to the tab that says Find a Doctor, and you will be able to find all the specialists, guests, and friends of the show that have been with us in the past and in the future. And yeah, just if you think your brand aligns with our brand and you would like to advertise your brand on our platforms, you may also just use the link that's on the screen now, or just send us a DM either on Instagram or Facebook. And yeah, Doc, it's been a pleasure. I'm still grumpy.
I'm sorry.
Yeah, it's okay.
And of course, just to remind our audience, you know, tell a friend to tell their friend. Don't forget to subscribe, make the circle bigger. We always welcome everybody into the family. And again, it's been a wonderful month sharing the beautiful, you can see the sun is in my eyes, but it's been really phenomenal. So it's really been great. Thank you.
And thanks for making the time, Doc.
It's been an absolute pleasure. Thank you so much for having me.
Thank you.
So till next time, this is Ask Your Doctors. Keep asking your doctors. My name is Dr. Mashishi, and we hope to see you soon.